Hi, everyone. On this episode of qrsTV, we are going to tackle rhythm diagnosis in a 12-year-old female spayed golden retriever. So let's refresh our memories with all the questions that we try to ask related to rhythm diagnosis. And we'll start with number one, heart rate. So I chose to use the 300 rule. And what I'm doing here, because the paper speed's 25 millimeters per second, I'm sort of estimating heart rate based on single intervals. And for the most part, they fall between about 80 and 120 beats per minute, with the exception of some that are a little bit tighter intervals, up to 170 beats per minute. Next is the rhythm regular or irregular, and I think we can appreciate that it's irregular, sometimes gradually so, and on a few occasions more abruptly so. Next question, is there a P for every QRS complex? My answer to that is no. Certainly towards the left-hand side of the trace, we can see nice P waves in front of our QRS complexes, but I've circled a couple of heartbeats that I think do not have identifiable P waves in front of them. Next question, is there a QRS for every P wave? I think there is. When we do have identifiable P waves, there is certainly a QRS that follows. Are the P waves all the same? Yes, I think they are within reason. Are the QRS complexes all the same? Clearly not. And so I've circled sort of three different populations. We have the more narrow looking ones toward the left, and then the middle and towards the right, I've circled some complexes that are more bizarre and different looking. Is the PR interval constant? I think it is for the heartbeats that have P and QRS that follow within reason. And are the P waves positive in lead 2? Yes, they are. So now we need to take the responses to all those questions and parse it out into a rhythm diagnosis or rhythm diagnoses. So I think based on some of our answers, we can focus on the trace towards the left-hand side of the page, so the first half of the trace. And I think that that satisfies criteria for sinus rhythm. And specifically sinus arrhythmia, because the R-to-R intervals are changing gradually, but those look like nice normal complexes with P waves that are associated. And then we need to tackle sort of the other part of the rhythm diagnosis here, because that's not all that's happening clearly. And so we identified that there were a few beats that came maybe a little bit earlier than expected in terms of the normal sinus rate. And furthermore, those heartbeats look different than the other ones. And so we can now apply the terminology premature beats because they're early. And now we need to figure out what type. And you may recall from a previous episode, we talked about atrial premature complexes. And these ones on this particular ECG are unique in that they are wide and bizarre looking, so very different looking than the normal complexes. And that's really relevant. Because that might share with us where they're originating from, and specifically the ventricles, because if they're arising from the supraventricular area, atrial or AV node area, they should look the same as the sinus complexes, more or less. But again, these look very, very different. And so we might infer that they're coming from somewhere different and taking a very different pathway of conduction through the heart, which is what ventricular premature complexes do. And then the other criteria is, we already said that they don't seem to have associated P waves or atrial activity with them. And that would fit with something of ventricular origin as well. And so my conclusion here is that these are premature complexes, specifically ventricular premature complexes, or PVCs. And if we wanted to get even a little bit more detailed with our terminology, we could use the words isolated and multiform. Isolated meaning they're occurring one at a time, at least for the ECG that we see. And multiform meaning they look different from each other. And on the next episode, we might dive into that a little bit deeper in terms of what that means relative to perhaps their point of origin. Hope that helped, and we'll see you next time.